Hi, I'm Dr. Sarah Trunk, and I'm a doctor of physical therapy and co-owner of Balance Within Integrative Physical Therapy. We help people overcome aches and pains and enable them to really enjoy life and get back to an active lifestyle. And that's no matter how simple or how chronic or complex their symptoms may be, whether they've been there for a few weeks or months or years. Oftentimes the types of patients that seek us out or the types of conditions that we'll often treat include just general aches and pains, back pain, neck pain, headaches, TMJ issues, pelvic pain, running and sports injuries, and then a population that's very, very near and dear to our heart is a chronic pain population and also fibromyalgia. There's all sorts of people that come find us and maybe they've experienced looking at traditional therapy approaches or various other practitioners and that hasn't worked out for them, but with our unique and really integrative, holistic approach looking at the full body, we're finally able to help them meet their goals, even if they've almost given up hope or everybody else has for what their goals are. So the way that we do this is by combining the best of many different approaches, including the evidence-based physical therapy, orthopedic, sports medicine world with the John Barnes Myofascial Release. We're the only physical therapy practice in Wisconsin that has 4 therapists that have obtained the prestigious advanced or expert level John Barnes Myofascial Release certification. So that's really the core of our practice, and that approach, the myofascial release one that I'm talking about, is a very gentle, hands-on approach that's great for chronic symptoms. And then in addition to that, specifically myself, I also specialize in women's pelvic health conditions and with the pelvic floor. So if your pelvic floor isn't strong enough, or maybe it's too tight or not coordinating properly, you might be experiencing some urinary leakage or constipation or pelvic pain. And sometimes that can even be the root cause of chronic hip and back pain that's not responding to other approaches. So I love to integrate that piece as well to help my patients. Professionally, my background is I do have a doctorate of physical therapy from the University of Minnesota, and all throughout my life I always knew I wanted to be in a helping profession, and I just fell in love with physical therapy when I was in my 20s. And once I graduated from school, though, I was really disappointed because I found that what I was looking for was really quality time with my patients, getting to empower them to take on their own health and well-being and really help them from point A to point B. But I found that our industry really focused oftentimes too much on volume instead of on quality of care. And at first I thought it was me, but later on I wisened up and realized that if I was being asked to treat 2 and 3 patients at the same time, I just couldn't give them the care that they deserved. My husband, who's also a physical therapist, felt the same way, and so we decided to create our own practice where we could see our patients one-on-one, and that was 4 years ago, and now we're so grateful to be here where we are. Again, we, in addition to wanting to really give that quality one-on-one care, we really found that there were some missing links and missing pieces in the traditional therapy approaches, which included things like the myofascial release and women's health. And then we've also added on specialties including craniosacral and visceral manipulation and some others too. So we love putting all of these rare specialties together to, again, have the best of both worlds of traditional and integrative and really get our patients great results even when other things haven't worked for them. So if you'd like to learn more about me or our practice and what we do and if we could help you out, I'd invite you to look at our website at balancewithinpt.com. And we do also offer a free 30-minute consult to anybody that would like to have us take a look and just learn more about how we might be able to help you too.